I'm going to take a deep breath on this one. This week, the Centers for Disease Control and Prevention issued a report showing autism rates have risen dramatically over the past 2 decades. One of the authors said it is because doctors have gotten better at identifying it. As for the underlying cause of the developmental disorder, experts say that there's not a single cause of autism, and the leading theory lies in genetics. But Health and Human Services Secretary Robert Kennedy Jr. seemed to directly contradict his own experts when he addressed the findings.
This is a preventable disease. We know it's an environmental exposure. It has to be. Genes do not cause epidemics. These are kids who, many of them were fully functional and regressed because of some environmental exposure into autism when they're 2 years old. And these are kids who will never pay taxes. They'll never hold a job. They'll never play baseball. They'll never write a poem. They'll never go out on a date. Many of them will never use a toilet unassisted.
And that is not true for many, many, many people all across the autism spectrum. Here to break this down, Dr. Vin Gupta, global health policy expert, pulmonologist, and MSNBC medical contributor. Dr. Gupta, your reaction to what we just heard from the HHS secretary.
You know, Stephanie, I say this within the four walls of a hospital. I'm sorry for my garb and the lighting here, but it's to say that for those of us that are actually caring for patients, it's disgusting. It's vile. And it's just, we've almost lost a sense of what we can express outrage to and how to do it and under what tones. Everything he just said is completely false, as you just said. Just because you might be diagnosed with autism doesn't mean you don't know how to use the toilet. And my wife, for example, is a pediatrician, is focused on this, on behavioral pediatrics and developmental pediatrics. None of this is true. And, you know, more broadly speaking, he's distorting the truth coming out of his own CDC, as you beautifully said in the tee up here. This is all about us having increased clinical awareness, increased diagnostic accuracy screenings to understand and identify autism spectrum disorder at an earlier age. It's like, for example, I'm a pulmonologist, Stephanie. We have now better ways to screen for and diagnose lung cancer. So the rate of lung cancer frequency is a lot higher than it was, say, 50 years ago. Does that mean that we're doing something differently or that there's just more risk factors? No. If anything, smoking rates have declined. And so he is just misinterpreting, cherry-picking data, as he always does on fluoride, on other topics. But he's saying some pretty hurtful and vile things.
But when people look at the numbers, right, there's obviously way, way more people diagnosed today than when, say, you and I were kids. But that's just because the diagnoses weren't coming. But I think about your wife and all sorts of families that she sees, and they are giving time and space and attention to Robert F. Kennedy Jr. because they do want answers, right? So is there any space for more research into this? Because there are families that are lost or overwhelmed or confused. And without those answers, they turn to someone like RFK who's saying, well, we can solve this.
Yeah, sure. But you know what he does is exactly 100% there's space for it. And that's what's happening. You know, if DOGE does not reduce the research funding for this important consideration, apparently they won't. This is going to get studied. That's a good thing. But what we do know, Stephanie, is that there's plausible explanations for this increased rate. So in addition to the fact that we're just paying more attention to it, we have better diagnostic screening tools. There's more clinical awareness. All those things, by the way, really, really matter, whether it's autism, whether it's lung cancer, whether it's the next thing. We also know maternal and paternal age at first birth of your child is increasing. That's a big risk factor for autism. We also know environmental exposures like air pollution, big risk factor. Genetics, you said in the tee up, big risk factor. So there's plausible, rational explanations for this, coupled with the research efforts that he's going to fund. That's great. We're all about evidence, but it's not going to in any way do what he wants it to do, which is somehow square peg round hole, identify data that's going to somehow fit his thesis or his narrative. That's not what's going to happen, even despite his best efforts.
Let's talk about something else he wants to do. He wants to get all of us off ultra-processed foods. I am absolutely on board for that. But then today we learned that a leading expert on these foods studying this is now leaving HHS after 21 years. And he is citing that he's leaving because he's worried about political interference into his work. And I want to share a bit of what he told my colleague, Chris Hayes.
What is it going to be like if they want to start, actually meddling in the research itself? Yeah. That was my concern.
You would think this guy is the ideal person working under RFK. What does it mean for Americans' health if experts like this are afraid to do unbiased research?
Well, Stephanie, I mean, this is just the tip of the iceberg here. Let's just talk about the ways in which they like to talk about the MAHA agenda, Make America Healthy Again agenda. Well, let's say from the clinical community, and I think I speak for a group of clinicians, Stephanie, across the country that you'd want caring for your loved ones, for mom and dad, grandma and grandpa, or your children. And so what's happened? Well, what have we looked for? What have we seen as clinicians across the spectrum that you trust to care for your loved ones? We've seen food safety committees disbanded. We've seen de-investments in veterans' health care. We've seen critical therapies for Alzheimer's and cancer screenings be put on hold because of DOJ-related efforts to cut NIH funding. This is impacting, whether you're a Republican or a Democrat, this is impacting everyday Americans. There's no political angle to any of this. Supporting the tobacco industry. Actually, they just stopped funding for the state quit lines for tobacco cessation across the country. It is being termed as the greatest gift to the tobacco industry in the last 50 years. That's under RFK and the leadership of this new administration. And, obviously there's all the isolation from the world pulling out of WHO. This is their actual agenda. This notion that we haven't been talking about ultra-processed foods, eating healthy, we've been talking about that for decades. What it requires is access, Stephanie, as you know, to primary health care, not cutting Medicaid and threatening to do that across the spectrum. What they're talking about here, the reality is coming into bear. None of it is in any way equated to a healthy existence and to frankly living a long life. And we're seeing that actually play out in the policies they're enacting.
Well, we're going to need you here to fact check quite a few things over the next few months. Dr. Gupta, always good to see you. Thanks for being here.
Thank you.
We'll be right back.